Hi students, I'm just going to do a review of your radiology section. So let's go ahead and get started. We will go through the objectives through the PowerPoint, the outline. We're going to look through the terminology, just the radiology itself, guidelines, subsections. So let's go ahead and start off with radiology itself. So remember, you're going to have those diagnostic radiology, which those are going to be your x-rays. And you always look in the back of the book and the index to get where you need to go. You can always have diagnostic ultrasounds, guidance, mammography, bone joint studies, radiation oncology, and nuclear medicine. So one thing you have to remember with the radiology, same thing with an x-ray. Once you have that subsection, it's going to be further divided. So it's going to be divided into the leg, the knee, the ankle. So it's going to get a little bit more, specific there. Another thing with diagnostic radiology, you're going to have non-invasive. Again, they're not going into the skin. And then invasive, that's where they are going into the skin, puncturing. And then we have therapeutic, which is interventional procedures. And then you're going to have computed tomography or an MRI. So a couple of different things. Remember radiology, a lot of times those x-rays, those are going to be more for bones, okay? Radiology, when you have the x-rays, are going to be more for bones. Where when you get into your computed tomography and MRI, it's going to be for like ligaments, anything torn muscles. That way they can see that better. Okay, how would you define the radiology branch of medicine and its physician specialist, a radiologist? So radiology is the branch of medicine where this radiologist is your physician. This takes you right back to med term. Okay, so here's some different things that you need to know for radiology terminology, different procedures, angiography, cardiography. So I'm not going to go through each thing, but again, this is something that make sure you study, look them up for the definition. I always like these pictures that they have. What for radiographic projects and their definitions? What are the four, I should say? And here, this is kind of good to know. We have the anterior posterior, tells you how the patient is positioned. We had these, if everybody remembers, back in medical terminology too. Lateral or side, oblique projection, posterior anterior projection. We have overview. I talked about these again. I'll go into a little bit more here. Couple of different things that I want to talk about. So the procedure description includes the type of service, where it was at, and did they put any contrast material? And when I'm talking contrast material, keep in mind that is like what is put into, like if they're doing a invasive, they could shoot dye in, and the dye a lot of times helps with seeing what's going on inside the body. And then we also have, remember the professional component and technical component. The professional component, which is going to be modifier 26, that is the physician or radiologist reading that report, interpreting that report. Where the technical component, that is going to be the facility actually doing the procedure itself. All right, so you're going to have two components. Now, if a facility, let's just say Mercy Hospital, they have a radiologist there, they have an x-ray machine there, everything is done at that one facility, you're not going to need to put modifier TC or 26 on it. This is, if you would have to send that report out for a radiologist to read it, that radiologist is going to put a 26 on that x-ray or whatever they did read. So that way the insurance company knows how to split that code for money-wise. Keep in mind, all your codes are based on a money value, and so much is for the technical component and so much is for the professional component. Modifiers used with radiology codes, or you're going to have possibly reduced services. This could be if they did an x-ray and it says 2 views, but let's say that they only had to do 1 view. So we're going to put a 52 on there and not as charge as much. 76, repeat procedure. Complete procedure, this refers to the number of views required for study of a designated body part. So they did the whole thing, all right? Okay, they also have E&M. Keep in mind with here, E&M services are part of the radiographic procedure. An E&M code is not reported except when a radiology provides significant, separate, identifiable E&M service distinct from radiographic procedures. So services provided by a radiologist include minimal history and exam to determine why are they doing it, is there allergies, possibly a follow-up, informed consent, and review of the patient record. Okay, that is minimal. Complexity medical decision making is usually limited to whether invasive or interventional procedures should be performed. Was there any comorbidities, coexisting conditions that impact that procedure? And then what discussion and education took place with the patient? Okay, so how would you describe the technical component associated with radiologic procedures? The technical component associated with the procedures are services provided by your radiologic technologist, such as performing examinations, administering radiation and therapy treatments. All right, radiology section guidelines. Provide instruction about the following. Okay, the subject listings, separate procedures. Once again, if it says separate procedures, was there a bigger procedure this could be a part of? All goes into the bundling and unbundling. We have special reports, those unlisted procedures, supervision and interpretation. A lot of times, if your 7000 code has supervision interpretation at the end of it, that means you need a surgery code with it. And it will usually list those surgery codes out, 3000, 5000 codes. Administration of contrast material, written report, foreign body implant definition. Okay, so here's just a injection device. So how would you define foreign implant or foreign body implant? All right, I'm just going to hold it here. You can review it instead of me completely reading through this section. Okay, so we go into radiology subsections. Talked about this here. We have diagnostic radiology, and I kind of talked about that. X-rays, goes into ultrasound, mammography, bone joint studies. There's a lateral chest X-ray, abdominal CAT scan, a CT. It shows you the different planes that they do it. Reconstruction, MRI unit. I don't know if anybody's ever had an MRI. I've had one on my knee before. You have to sit very, very, very still. And an MRI of the brain. Okay, so this is a great little guide right here, type of radiological guidance and purpose. So make sure you use this as a reference. I do have the PowerPoint uploaded also, so you can take time and study this. Okay, this is mammographic imaging, implant. So a lot of these give you some nice pictures. Fluoroscopic guidance is performed for visualization of the left subclavian vein during placement. A non-tunneled central venous access device, which would be a catheter. Use your CPT code to manually assign appropriate codes. And here you go. This kind of helps you out. As you can see, we are using the 7000 code, but also with that, we need a surgery code too. And a lot of times when you look these up, they will put you in the right direction of what other code you need. Do not report modifier 51 with an add-on code 77001. And the biggest thing here when you do radiology, always look under the code for little specific notes. Those will help you and guide you through this section. It will tell you do not code this or do code this in addition. So pay attention, read a little bit more in there. Okay, this is a little self-assessment for yourself. And then your summary. If anybody has any questions on the radiology, please let me know.